Yes, my viewers and subscribers, if it's the first time on my channel, don't forget to subscribe, like, comment, and share. Permits for public gathering banned. On the heel of the Bahamian recording its first case of COVID-19, Bahamas Public Parks and Public Beaches Authority Executive Chairman Shanendon Cartwright announced yesterday the permits for organized public gathering have been banned indefinitely. The Bahamas Public Parks and Public Beaches Authority, in consideration of the public health concern, wishes to advise the Bahamian public that both existing permits for organized public gatherings and the issuance of any further permits are suspended effectively immediately until further notice, Cartwright says. The Bahamas Public Park and Public Beaches Authority thank the Bahamian public for your continued diligence as we prioritize the nation's public health concern. In an effort to help slow or prevent the spread of the infectious COVID-19, public health officials both locally and worldwide have been encouraging people to practice self-distancing, which include avoiding large public gathering and all unnecessary travel as much as possible. Officials are also encouraging anyone who feels ill to self-quarantine by staying at home, away from their family members, and contacting the emergency COVID-19 hotline. Since its emergence in December, COVID-19 has spread to all continents except the Antarctica, and its case continually to dramatically increase. As of yesterday, over 153,000 cases have been reported worldwide, with over 5,700 deaths, according to the World Health Organization, who has last week declared a pandemic. So the Bahamian is experiencing its first COVID-19 case, and there is a headline and what will be coming, what the year they in a conference that the Ministry of Health has spoken about, and they are saying that there are numbers to call. He said he remind the public, if you have respiratory problems of symptoms of fever, cough, shortness of breath, call your doctor's office or the Ministry of Health COVID-19 hotline at 376-9350, 376-9387, or 376-9357. And a health professional will discuss your symptoms and determine the next steps. We'll update on additional number which will be added. So the Bahamian public are asked to wash their hands thoroughly with 60% hand sanitizer, soap, and water for 20 seconds. Do not touch your face with your hands. Keep social distancing of 3 to 6 feet from person. Do not shake hand, hug, or greet by kissing. If you are sick, use respiratory hygiene. Cough in your sleeve, not your hands. Cough in a tissue and dispose the trash can immediately. Stay home if you're sick with flu-like symptoms. So the Bahamian public are warned. And I think many of us can also take the same warning with us, because it's the same COVID-19 spreading across. Minister Lloyd stressed that the case was detected in the health system because of Ministry of Health enhanced surveillance method for COVID-19. These measures include physician reporting patient who present such respiratory infection and testings were indicated. So don't go and say you didn't hear. The Bahamian people, my Bahamian friends, please take advice. And as much as possible, we want to gather together, we want to pray. Yes, but be careful. Though we believe that God has sanctified all of us, but there is wisdom and we've got to use it. Don't go out there and say you're putting God to the test. Many have done that before us in many different other cases, and they end up being dead. So be careful out there. If you're going to travel, seek advice. Don't just jump and go all over the place. Be careful because you have been warned. Coronavirus, don't take matters in your hands. It has come to wake up a lot of us to let us realize a lot of things. We don't want to speculate. We don't want to put anybody in fear. You see, but if you find yourself having symptoms, report it. Don't go just jumping and say, oh, nothing is wrong. And then when at the ending of the day, your families are crying. My Bahamian friend, do that and you will be okay. Trust God and live. Exercise patience and let wisdom speak for itself. Once again, this is J-Con TV out of Zurich, saying unto each and every one of us, walk in peace, my friend. Shalom.
Thank you very much for joining us. The Bahamas today confirmed its first case of COVID-19 here in New Providence. The patient is a 61-year-old female resident of New Providence who does not have a relevant travel history. She presented with symptoms of fever and cough. She is not known to have traveled outside of the country in the past 20 days. And at this time, the patient's exposure is unknown. The patient and family members have been informed of this diagnosis. She is receiving care in the designated isolation area of the Princess Margaret Hospital. We are currently investigating her family and social contacts to determine whether they could have been the source of her infection. This case was detected in the health system because of the Ministry of Health's enhanced surveillance methods for COVID-19. These measures include physicians reporting patients who present with respiratory infections and testing where indicated. We made the decision to expand our testing and have heightened a sensitivity for persons presenting with influenza-like symptoms due to lessons learned from countries that have diagnosed cases in keeping with this enhanced surveillance approach. The investigation is ongoing, and we will update the public within the next 24 hours. Steps are now being taken to respond to this public health threat. These measures include aggressive and extensive contact tracing, recommendations to the community efforts to mitigate transmission, and it is crucial that we understand now that to prevent further transmission depends on what we all must do individually and collectively. To prevent becoming infected with COVID-19, you must, 1, wash hands thoroughly with 60% hand sanitizer or soap and water for 20 seconds. 2. Do not touch your face with your hands. 3. Keep social distancing of 3 to 6 feet from persons. 4. Do not shake hands, hug, or greet by kissing. 5. If you are sick, use respiratory hygiene, which includes cough into your sleeve, not your hands, and cough into a tissue and dispose in a trash can immediately. 6. Stay home if you are sick with flu-like symptoms. 7. If you feel your symptoms require medical care, call your doctor's office or the COVID-19 hotline before you go to the clinic or hospital. There are also strategies which can be applied in various settings for mitigation of community transmission or impact of COVID-19. Homes, schools, workplaces, churches, assisted living facilities, and healthcare facilities all must become informed and adopt measures to slow the transmission of disease and in particular to protect A. individuals at increased risk for severe illnesses, including older adults and persons of any age with underlying health conditions, and B. the healthcare and critical infrastructure workforces. I want to use this opportunity to appeal to the public to remain calm and to follow and implement the advisories relating to personal hygiene and overall infection protection control. And please, rely on credible and certified sources of information to stay up to date on coronavirus in the Bahamas. The government of the Bahamas will continue to keep the public informed as we manage this public health challenge. We remind the public, if you have respiratory symptoms of fever, cough, shortness of breath, call your doctor's office or the Ministry of Health's COVID-19 hotline at 376-9350, 376-9387, or 376-9357. A healthcare professional will discuss your symptoms and determine the next steps. We will update on additional numbers which will be added. Thank you. Please.
Can you confirm whether she's Bahamian? I think you said resident of the Bahamas. Is she Bahamian or does she have residency?
She lives in the Bahamas.
She lives in the Bahamas.
Yeah, she's a resident. She's a resident of our country.
So that means she's a naturalized resident? So she lives in the Bahamas. I mean, that's different from being Bahamian. What I'm trying to determine.
To my understanding, she is Bahamian.
They indicated that the family is being tested. Does that mean that the family has also been put in quarantine? And can you tell us how many people?
Well, we are early in our investigations. What we would have said, certainly we would come to the public as soon as we are aware of a case of